assembly. Sometimes it is evident, but other times we're covering it up pretty well because we tend to have a routine that we go through when we're together. People with mental illness are overrepresented in homelessness, in prison population, and they're often experiencing economic discrimination and injustice. And my oldest son, who is Latino, has experienced all three of those. All of those outcomes ought to be of tremendous concern to the people of God. So we'll talk a little bit about mental illness, but let's also be reminded of what we're speaking of with domestic violence. Abusive, coercive, forceful, threatening actions or words toward one family member or a member of the household. When we think about words, the Bible challenges us to let no unwholesome word proceed from our mouth, but only such as a word is good for edification. And the word for edification literally means house building, building up the family, building up the house. Words can do that, but they can also destroy. When you think about abusive actions, those actions would include a push, a slap, a hit, or as was the case with my co-worker's sister, even murder at the hands of her husband. Domestic violence in this context is referring not only to married couples, but also to those who are cohabitating. And we want to include today certainly the topic of sibling abuse, where one sibling is always the recipient and another is always the one dishing it out. That's different than if you and your brother had spats and wrestled and and were at each other, or two sisters were always at it. Sibling abuse is when one is always on the receiving end and one is always dishing it out. Certainly, in our context today, this includes abuse toward elderly relatives. So it occurs in every racial, socioeconomic, ethnic, and religious group. And we know that conditions such as poverty, drug and alcohol abuse, and as the lesson suggests, the title suggests this morning, even mental illness can, although not always, increase its likelihood. So perpetrators of domestic violence are in our churches. Do we know that? They're in our churches. Sometimes in roles of leadership. Sometimes they're not hiding over in the corner. Sometimes they're just right up front, which inflicts even more pain upon those who know the reality of what's going on at home. Proverbs 28 verse 13 says, "He who conceals transgressions will not prosper, but he who confesses and forsakes them will find compassion." We got perpetrators in our churches. We got victims in our churches, usually hiding their situations very well. Nevertheless, they're hurting deeply. According to an article in Time magazine, 1 in 4 women experience domestic abuse in their lifetime. 1 in 4. And it is a very underreported crime. So in my first preaching work, I wasn't there but maybe a month or two, and this lady called and she said, "I want to bring in my husband and my kids for some counseling." And I think I was all of 24 years old or something, I don't know, or in my early 20s. And I said, "Well, sure." And so she brings in, I asked her what the situation was first. She said, "Well, my husband been hitting me with a hammer in front of the kids." So I said, "Well, okay, well, yeah, we'll see if we can help you out. Come on in." So in my naivety, I was going to 1 Peter 3:7, thinking this man had a spiritual issue and I was going to help him live with his wife in an understanding way as with a weaker vessel. granting to her honor as a fellow heir of the grace of life so that his prayers wouldn't be hindered. In my naivety, I thought I was going to be working with him about anger and how the anger of man doesn't accomplish the righteousness of God. I thought we would be talking about control and what it is about his sense of control, or maybe abuse in his childhood. I had Ephesians 4:31 ready. Let all bitterness and clamor and anger and wrath be put aside. But instead, when this family showed up with the 5 kids, both the victim and the perpetrator, both said, we're here to help her become a better wife. You see, the perpetrator had presented himself as the victim. If she had been a better wife, if she had been more responsive to him, if she would be better with the kids, then we wouldn't have this going on. I read the other day in a study that took place with the University of Bristol. It asked, do men who are perpetrating domestic violence have a higher incidence of mental health problems? And they found out that the men who are forcing sex upon a woman, making family members feel frightened or physically hurting them, were 3 to 5 times more likely to suffer from anxiety and depression than other men. And so their conclusion was that primary care physicians need to be more sensitive to the effect that anxiety and depression, and especially depression, is having upon the male population. Especially since 200 commonly prescribed drugs have as their potential side effect depression, painkillers, antacids, blood pressure medicine. And so there is a need for more mental health questions, evaluations, and interviews. And if physicians would do that, this study showed it would save more lives, help keep families intact, and reduce prison rates in our local and state jails. So there's 3